Today we will be going over the Boston Assessment of Severe Aphasia. The Boston Assessment of Severe Aphasia, or BASA, is used to assess preserved expressive and receptive language abilities as soon as impairments become evident. The BASA can be administered at bedside and takes approximately 30 minutes to administer and about 20 minutes to complete an analysis of the assessment. There is no specific age range for the test, but it is intended to use specifically on aphasic individuals. The test is normed on patients whose communicative abilities have been impaired and have been diagnosed with severe aphasia. The population referenced in the norm consisted of a wide range of ages and widespread times between onset and impairment symptoms and testing. These patients also had a wide range of diagnoses, including Wernicke's, Broca's, and global aphasia. One aspect of the assessment is to determine if the severity of the patient's aphasia would be classified as global aphasia. Therefore, the test contains separate tables for severe aphasia norms and global aphasia norms.
The testing kit normally includes one manual, record forms, one metal clipboard, yes/no knobs in a plastic holder, one plastic pointer, one toy gun, one pair of glasses, 3 sticks, 37 stimulus cards, and a briefcase. These materials are used to test auditory comprehension, praxis, oral gestural expression, visual spatial tasks, and reading comprehension. During the assessment, the clinician will present the patient with different stimuli to elicit a response, whether it be gestural, verbal, or both. These responses are then recorded in the recording form as gestural or verbal. Each category also has a ranking scale for the communication quality of the given response. The client receives a 2 if it is fully communicative, a 1 for partially communicative, and a 0 for non-communicative. They could also receive an R for refusal or rejection of the task. The response is also scored by its affective quality and if it is a perseverative response. The scoring manual also gives guidance on how to score each individual item.
For demonstration purposes, we will be administering 1 to 2 questions from each section, but typically the assessment should be done in full in the order provided in the record form. Our client today is a 58-year-old female, 2 days post-stroke, exhibiting difficulties with predominantly expressive language. She has no other physical complications from the stroke. Hi, are you Miss Smith?
Yes.
Are you Miss Brown?
Yes.
My name is Erica Lewis, and I'm a speech-language pathologist, and your doctor has asked me to talk with you to see how you are coming along. How are you feeling today?
Good.
What happened to you?
Stroke, fell.
I was wondering where you live. Do you live in Mississippi?
No.
What month is it now? What part of the month are we in? The beginning, middle, or end? Where do you live? Okay. I want you to do what I tell you. Close your eyes. Now I want you to take a deep breath and say ah and hold it until I tell you to stop. Stop. Could you sing row, row, row your boat?
Row, row, boat, row, boat, boat.
Okay. Can you repeat after me? Money.
Nunny.
Why not?
Why?
Okay. Now I'd like you to do something with your arm and your hand. Show me how you salute or pledge allegiance to the flag. Point to the number 2. How many is this?
2.
Which picture shows this? What is he doing?
Talk.
Which one shows sleeping? Which word goes with this? Take 6 cents. What goes with this word? Who is this?
Hitler.
Tell me what this says.
Love.
Tell me what this is.
No. No smoke.
I want you to draw a picture of this man. What matches this? Which one was this? This says that you finished the test and you understand that the test results will be used to better plan your rehabilitation program. Please sign your name on a dotted line. Goodbye.
After the assessment has been administered, the total number of gesturally communicative responses and the total number of verbally communicative responses is recorded and converted into percentages, as shown here with the scores from our previous demonstration. The performance summary page is then filled out to find the raw scores for each tested category. This raw score is used with tables in the scoring manual to find the standard score, confidence interval, and percentile rank. The same raw score is used when looking at tables for severe aphasia norms and global aphasia norms.